Let's learn appendicitis today. It is an inflammation of appendix. And what is appendix? It is a small, thin, tube-shaped organ about 5 to 10 cm long and which is connected to the large intestine. Nobody knows exactly what the appendix does in our body or the function of this organ. Let's see the causes of appendicitis. In many cases, the cause is not clear, but possible causes are Appendicolith. It means hard lump made when feces and minerals clump together. Infections. It can be bacterial or viral in the digestive tract or somewhere else in the body. In infection, yes, there will be swollen lymph nodes like this, rapid proliferation of lymphocytic cells that will block lumen of appendix. Lumen refers the space within the hollow organs. This rapid proliferation of normal lymphocytic cells is called lymphoid hyperplasia. Inflammatory bowel diseases, benign or malignant tumors. Do you know? Generally, mucus created by appendix empties into large intestine. And what happens in appendicitis? To get a clear information, we can see pathophysiology. Initiation of acute appendicitis with the lumen obstruction and mucus accumulation. In this picture, you can see obstruction here and mucus accumulates in this space called lumen, which is marked as green color. Usually, we said before, mucus secreted by appendix is excreted to large intestine, but here, due to obstructions, it continued to accumulate here in the lumen of appendix. This leads to increased luminal pressure, appendiceal distention, and inflammation. What will happen if luminal pressure increased? It causes small vessels thrombosis and lymphatic flow stasis. It results in tissue ischemia and bacterial buildup, rupture of the necrotic appendiceal wall and subsequent release of bacteria and pus. Now the appendiceal wall is very fragile due to necrosis or ischemia. Then it will rupture and release bacteria and pus into peritoneal space. Perforation of the appendix into peritoneal space leads to abscess, phlegmon, and generalized peritonitis. Risk factors. Anyone can develop appendicitis, but most often happens in people between the age of 10 and 30, and male have slightly higher risk. Signs and symptoms of appendicitis. Abdominal pain, initially sudden cramping pain in the middle of your abdomen, around navel. Within hours, pain travels to right lower quadrant where is appendix located. Then pain typically increases and becomes constant. The size of the pain may vary depending on age, the position of appendix. In pregnancy, the pain may seem to come from the upper belly because appendix is higher during pregnancy. Constipation. In appendicitis, body redirect blood flow from your bowels to appendix. This causes decreased bowel movements, leads to constipation. Diarrhea. This may be due to inflammation of appendix is irritating and portion of the colon. Malaise. It means feel generally unwell. Urinary symptoms like urinary frequency. Appendicitis irritates the nerves connected to the bladder. Nausea and vomiting, loss of appetite, belly bloating, and low-grade fever. Fever that may rise as the illness worsens. Let's see certain important signs which is seen in appendicitis. McBurney's sign. Before that, what is McBurney's point? It is a common site of maximum tenderness in acute appendicitis. This point is about 2 inches along and 1/3 of the distance in a line from right axis. It means right anterior superior iliac spine to umbilicus. You can see the McBurney's point here, which is the most typical location of appendix. Palpation at this point causes tenderness is a positive sign of appendicitis is called McBurney's sign. Blumberg's sign. It is a clinical sign where there is a pain upon removal of pressure rather than application of pressure to the abdomen. This is also known as rebound tenderness. Rousing sign. Pressure on your left lower abdomen produces pain on your right side. Nausea sign. If your appendix behind your colon rather than in front, appendicitis may irritate your psoas muscle. So this is a pain elicited by the patient lie on his left side while the right thigh is flexed backward. Dunphy sign. Sharp pain in the right left quadrant elicited by a voluntary cough. Obturator sign. Discomfort or pain felt by a patient on the slow internal movement of the hip joint while right knee is flexed. It indicates inflamed pelvic appendix that is contact with the obturator internus muscle. Next is diagnostic measures. When you consult a doctor, he will check pain location first. As we discussed already, the pain begins around navel and moves to your right lower quadrant, and some people feel the pain elsewhere. Blood test includes CBC and CRP. It helps to identify any infection, and urine analysis. Imaging studies like abdominal ultrasound and CT MRI also helps to identify swollen appendix. Treatment and management. Appendicitis is considered an emergency. Treatment includes medications and surgery. Though in a small number of cases, medications might be enough. Pain medications, antibiotics, this is also preventive treatment before surgery. Appendectomy is one of the most common surgical procedures performed worldwide. It using minimally invasive methods such as laparoscopic surgery. It is a surgical removal of appendix. Complication of appendicitis. Peritonitis is the most severe complications if your appendix bursts. If this video really helps you, please like, share and subscribe my channel. Thanks for watching.